What we also want to look at with Jack is to see, can he do this abdominal breathing? So if we bend the knees up, so all I'm going to get Jack to do is just to, and all I'm going to get you to do is to take a nice breath into the tummy. So a nice breath in and out. So you're going to just breathe into here. So here we have a good example of someone who struggles to do that. And this is can be reflective of the patient. So what we want is a nice belly breath, abdominal breath. So we want a nice breath, abdomen moving out, tummy relaxed, abdominals relaxed, pelvic floor descending. Whereas what you see with some of these patients is when they do that breath in, they co-contract, they do a sternal breath, abdominals contract, pelvic floor will contract. So this is the pattern we sometimes see with these patients. So what we want to get them to do is move to that more, we would get them doing a lot of exercise in various positions with the legs up, on maybe stool, bed, on kind of child's pose, prayer position, down in a supported squat, doing lots of that abdominal belly breathing. And the reason we get them doing that is to get movement through that pelvic floor. So if you do that abdominal breath, you get nice downward excursion of the diaphragm, movement into that pelvic floor. So this is where we really start to get into that realm of getting these guys doing a lot of pelvic floor relaxation rather than what they may assume they should be doing, which is the pelvic floor strengthening. And the other thing we get them to do as an exercise, or one of the key things, is a gentle pelvic floor lengthening or reverse Kegel. So a Kegel is where we contract. The reverse Kegel is what we're going to do is gentle downward pressure through the rectum, almost gently pushing something out. But we're going to do that downward movement when we do a nice breath in. So I'm going to go breath in, gentle pressure down, hold the pressure down for about 10 seconds, let go. And then with lots of these men, we do lots of abdominal work. We do some I think the internal work we do is very, very, very gentle. Gentle, sensitive mobility rather than very aggressive pain work. And then we also, for some of the men, if they need the internal work, we use this internal device, an EZMagic. You can Google it. And we would treat them with that, and we would show them how to use that at home. But it's all very gentle.